This is the terrifying reality that 7 little Johnstons, star Amber Johnston, faced when she suffered a massive brain stroke. Today, we dive into the story of Amber Johnston's sudden medical emergency, the events leading up to her hospitalization, her extremely critical health condition, and how her close-knit family and whole reality TV community are rallying around her in this dire moment. This is a story about love, fear, resilience, and hope. A story that reminds us of life's fragility and the incredible power of community when tragedy strikes. Stay with us until the end as we trace Amber's journey from laughter to tears and learn what you can do to support her during this battle for her life. Amber Johnston is no stranger to the camera. As one of the beloved siblings on TLC's hit reality show, 7 Little Johnstons, she has touched the hearts of millions with her infectious laugh, warm smile, and unbreakable spirit. Born into a family where each child has unique challenges, Amber included, her ability to find joy in everyday moments quickly endeared her to audiences around the world. Afflicted with osteogenesis imperfecta, or brittle bone disease, Amber has faced more than her share of obstacles from a young age. Despite multiple fractures over the years, she has never let that diagnosis define her spirit. Instead, she became an advocate for living life fully, no matter what health challenges arise. On the show, viewers saw her navigate relationships, family gatherings, and the ups and downs of daily life with grace, humor, and a deep well of courage. Her siblings, Anna, Emma, Elizabeth, Macy, and Jonah, have often spoken of how Amber lights up any room she enters. Though petite in stature, she stands tall in personality, compassionate, fiercely loving, and unafraid to tell it like it is. She's a daughter, a sister, a niece, a cousin, and to many fans an inspiration. But life has a way of reminding us that no matter how strong we are, none of us are invincible. In late May 2025, Amber Johnston experienced a medical emergency that has put her life in jeopardy and left fans around the globe praying for her recovery. It was a calm Wednesday morning, May 28, 2025. Amber had woken up just like any other day, greeted by the gentle hum of birds outside her window, the smell of coffee brewing in the kitchen below, and the laughter of her nieces and nephews playing downstairs. Her sister, Anna, had already left for work at the independent college campus where she teaches. Elizabeth was at home, caring for her own young children. The house felt cozy and familiar, a safe haven. Amber padded into the kitchen to grab a glass of water. She had been feeling slightly off, lightheaded at times, with a mild headache behind her eyes. At first, she chalked it up to dehydration or perhaps the stress of filming upcoming segments for the show. But by around 7:30 a.m., something shifted. Her right arm went limp. A sudden, searing pain shot across her head like a bolt of lightning. Clearing her throat, she tried to call out for her sister, but the words came out slurred and broken. Panic gripped her. Within seconds, Amber collapsed to the tile floor. Her vision tunneled. She could feel the world tilting to one side, each breath more labored than the last. The faint sounds of her housemates became muffled, her own thoughts swirling in a haze of confusion. As she lay there, fear coursed through her veins, because she knew this wasn't just another minor headache. Something was terribly wrong. It's Amber Johnston. She's having a stroke, I think. She can't speak, her right side is paralyzed. Please hurry. In that desperate moment, Amber's sister Emma, who had been on her way to take Amber to a routine doctor appointment, turned around when she heard a thud from the kitchen. She found Amber convulsing on the floor, her face twisted in pain. Emma sprinted to the phone, dialing 911, and staying on the line until paramedics arrived just minutes later. Paramedics arrived at the Johnston residence within 4 minutes of the 911 call. In the back of the ambulance, they administered oxygen and performed a quick neurological assessment. Amber was conscious, though barely able to respond. Her speech remained slurred, and she struggled to move her right arm or leg. On the way to Piedmont Atlanta Hospital, EMTs established 4 access, prepared for possible seizure activity, and communicated with the ER team to alert them of a suspected stroke patient arriving on code Alpha. By 8:05 a.m., Amber was wheeled into the emergency department. A neurologist was on standby. The emergency team prioritized a CT scan to rule out hemorrhagic stroke, bleeding in the brain. Within minutes, Amber was lying under the CT scanner, completely still, her heart monitored, her blood pressure cuff inflating repeatedly. The scan revealed a large ischemic stroke affecting the left middle cerebral artery, the blood vessel responsible for supplying oxygen to critical regions of the brain that control movement and speech. Time was brain. The attending neurologist, Dr. Rebecca Collins, explained to Amber's family that the longer they waited, the greater the risk of permanent damage. By 8:30 a.m., Amber was administered TPA, tissue plasminogen activator, the clot-busting medication that, if given within a narrow window, can dissolve the blood clot causing the stroke. It's a race against the clock. For every minute the brain is starved of oxygen, millions of neurons die. While TPA can be life-saving, it also carries risks, especially in patients with her medical history. Amber's brittle bone disease may complicate blood pressure management, as high blood pressure increases the risk of hemorrhage. Nonetheless, the medical team considered the benefits to outweigh the risks and proceeded. Once stabilized, Amber was transferred to the neurosciences intensive care unit. She was intubated, sedated, and placed on a ventilator to support her breathing. Since her level of consciousness remained low, continuous EEG monitoring was initiated to watch for seizure activity, a common complication after stroke. A nasogastric NG tube provided nutrition, and a Foley catheter measured her urine output. Nurses checked her NIH stroke scale score every hour to track her neurological function. Dr. Collins says, Amber Johnston arrived within the golden window, which gave us a crucial opportunity to use TPA. Unfortunately, she suffered a large vessel occlusion, meaning a significant area of her brain was affected. We immediately evaluated her for a mechanical thrombectomy. That's going in and physically removing the clot. Yet due to her OI and increased bleeding risk, we determined that the safest route was medical management. Right now, she's in extremely critical condition. Our focus is on preventing cerebral edema, managing her intracranial pressure, and hoping the penumbra, the area surrounding the core infarct, regains enough blood flow to recover some function. At this point, Amber's family was told that her prognosis was uncertain. The first 72 hours after a major ischemic stroke are the most precarious. The risk of the brain swelling, cerebral edema, peaks between days 2 and 4. If swelling becomes too great, it can lead to increased intracranial pressure, causing further brain damage, or even be fatal. For a petite woman already facing health challenges, every breath, every heartbeat matters. Because Amber suffered an ischemic stroke, the main treatments are both pharmacological and endovascular, like TPA and thrombectomy. But once that initial window of opportunity passes, the focus shifts to preventing complications like cerebral edema, pneumonia from reduced mobility, deep vein thrombosis, and secondary brain injury from fluctuating blood pressure or oxygen levels. Even if a stroke survivor makes it through the critical phase, rehabilitation is challenging. The brain is remarkably plastic, it can rewire itself. But that takes time, often months or years. Physical therapists work to restore strength and mobility. Speech therapists help patients relearn how to speak or swallow. Occupational therapists assist in regaining daily living skills. Yet outcomes vary widely. Some patients recover almost fully. Others are left with significant disabilities. For Amber, the combination of her osteogenesis imperfecta and her petite frame complicates everything. Even a mild drop in blood pressure could risk internal bleeding. Moving her is a delicate operation. Nurses must use extreme caution to avoid fractures. And the risk of aspiration pneumonia is high when a patient is sedated and intubated. Therefore, the team monitors her oxygen saturation and cough reflex every hour, suctioning her airway as needed to prevent complications. In times of crisis, family becomes everything. The Johnston clan is known for their unity, 6 siblings tightly bound by love, shared experiences, and their mother Tracy, who has always been their rock. Now they found themselves torn between faith and fear as they witnessed Amber fighting for her life. Tracy Johnston. Amber's always been a fighter. She's faced plenty of challenges with her health before, but this is different. We need prayers. We need hope. We need her to know how much we love her, and that we're not going anywhere. Each sibling took turns at Amber's bedside, holding her hand, talking to her as though she could hear every word. They brought small tokens of comfort. A soft lavender blanket embroidered with her name, a photo album filled with happy memories, and a playlist of her favorite worship songs. Because Amber's condition remained so precarious, visitation was limited. Only 2 family members could be in her room at once. Yet, even that small window provided moments of peace in an otherwise terrifying ordeal. They told her stories from home. How the garden was blooming, how her nieces learned to ride their bikes without training wheels, and how Macy finally perfected her famous chocolate chip cookies. Jonah Johnston. I've never felt so helpless. I want to go back and laugh with her, tease her about winning at bingo again this weekend. But right now, I'm just here, praying, and hoping she hears us. I know she's in there somewhere. Fans of 7 Little Johnstons quickly mobilized on social media, sharing hashtags Pray for Amber, flooding Instagram and Twitter with heartfelt messages, fan art, and video tributes. The Johnstons production team issued a brief statement. Our family is devastated but remains hopeful. Amber is in the best possible hands, and we appreciate all the love, prayers, and support. We kindly ask for privacy as she continues her fight. At the time of this recording, Amber has been in the neuro ICU for 4 days. Let's walk through the critical updates. Mechanical ventilation and sedation. Amber remains on a ventilator to protect her airway and ensure adequate oxygenation. Because she's sedated and intubated, she cannot speak or swallow. Nurses perform oral care every 2 hours to prevent ventilator-associated pneumonia. After her CT scan showed potential signs of cerebral edema, Amber was given mannitol, an osmotic diuretic, to help draw fluid out of her brain. In terms of neurological status, Amber's Glasgow Coma Scale, GCS, has hovered between 5 and 7, indicating a severe impairment of consciousness. To put that in perspective, Amber's scores vary based on sedation levels, but her brainstem reflexes, like pupil response and gag reflex, have shown slight improvement over the last 12 hours. Even these small signs give her medical team cautious optimism that her brainstem is still functioning, and that the ischemic injury may not be as extensive as originally feared. The next 48 hours are critical. Families of stroke patients often describe this as walking a tightrope. The danger of brain herniation due to swelling is balanced against the risks of bleeding, infection, and organ failure. The neuro team runs hourly NIH stroke scale assessments, checking her eye movement, pupil size, and motor response to ensure no new complications arise. Ms. Patel says, Amber's condition is extremely critical. We're watching her like hawks. Every hour, we're looking for any sign that the swelling is increasing. At the same time, we're watching her lungs for any secretions that might cause pneumonia, and her kidneys to ensure they're filtering properly. It's a delicate dance. Every team member must be in sync. As of right now, Amber is still in a coma. Sedation is lowered slightly every morning to see how she responds. But as you can imagine, the family walks into the room each day with bated breath, hoping for a sign, a flicker of Amber awareness. But the initial 72-hour swelling risk window hasn't passed yet. As long as cerebral edema remains a threat, the prognosis is very uncertain. Because strokes in younger individuals, Amber is just 31 years old, are relatively less common. Her case has piqued the interest of medical professionals across the country. We reached out to experts to shed light on what makes her situation uniquely challenging. Dr. Owens says, strokes in patients under 40 account for about 10 to 15% of all ischemic strokes. The causes can be varied, anything from congenital heart defects to blood clotting disorders, or even trauma. In Amber's case, her OI presents an unusual risk profile. Some patients with OI have fragile blood vessels, and minor falls or even sudden increases in blood pressure can precipitate a hemorrhagic event. Though she had an ischemic stroke, we can't rule out an underlying vascular abnormality contributing to her presentation. Dr. Martinez, managing intracranial pressure in patients with brittle bone disease is a nightmare. You can't position them normally, because the slightest misstep might fracture a rib or vertebra, causing further complications. Meanwhile, you need to keep the head elevated, avoid unnecessary stimulation, and ensure any procedures, like placing an EVD, external ventricular drain, are as atraumatic as possible. Dr. Lin, If Amber emerges from this coma, the rehabilitation process will begin immediately. Stroke rehab often starts in the hospital. Passive range of motion exercises, bedside mobilization, and eventually gait training, speech therapy, and occupational therapy. But with OI, every motion must be carefully measured. Her therapists will need to collaborate closely with orthopedic specialists to ensure they don't inadvertently cause fractures. Their insights underscore just how precarious Amber's condition is, and how even a small triumph, like a slight flick of her finger, would mark a huge milestone. News of Amber's stroke spread like wildfire across social media. Within hours, her hashtags were trending on Twitter. Fans posted tearful video messages, some recounting how Amber's optimism helped them through tough times in their own lives. "Amber taught me to love myself," wrote one fan. Another shared, "I became more aware of OI because of her. Now I'm a nurse helping brittle bone patients. Thank you, Amber." TLC, the network behind 7 Little Johnstons, released a statement postponing filming and promising to prioritize Amber's privacy. Several reality TV stars sent messages of solidarity, including cast members from Little People, Big World, who empathize with living with medical challenges on camera. Even local news outlets in Polk County, Georgia, where the Johnston family resides, held a candlelight vigil outside their home, honoring Amber's courageous journey. For the Johnston family, this is more than just a medical crisis. It's an emotional minefield. They've experienced hardships before: fractures, hospital stays, and setbacks. But none so sudden, none so devastating as a stroke. Tracy, the matriarch, recalls when Amber was born. The first signs of brittle bones, the early surgeries, and the doctor's warnings. "From the moment she came into this world, I knew she was special," Tracy once told our crew in happier times. "But I never imagined something like this would happen so suddenly." Tracy, "I'm terrified. When you have a child, you think you'll outlive them. But now, I feel like I might lose her. To see her lying there, no response, it's like watching a piece of my heart shattered." Anna has taken a leave of absence from her teaching duties to stay by Amber's side. Emma and Elizabeth alternate shifts, making sure someone is always with her in the ICU. Jonah has delayed his mechanic shop's grand reopening to handle family logistics, meals, bills, insurance calls. Macy, who's usually the comedian, has been silent for days, tears replacing her trademark jokes. Each sibling wears the weight of fear, guilt, and hope on their faces. Words of comfort pour in, from relatives, fans, and strangers moved by Amber's story. Some even started fundraising pages to help cover mounting medical bills. While most believe Amber's insurance will handle the hospital's costs, additional funds are needed for potential stem cell therapies, long-term rehabilitation, and home modifications once she is stable. As Amber hovers between life and death, the question on everyone's mind is, can she come back from this? Medical stability. If Amber can avoid complications, like pneumonia, sepsis, or secondary hemorrhage, she has a better chance of making it through the critical phase. Once swelling subsides, a follow-up MRI in about 5 days will show whether there is salvageable tissue in the penumbra, areas at risk but not yet dead. Dr. Nguyen says, even if Amber regains consciousness, her initial functional status matters. We look at her ability to follow commands, move affected limbs. If she shows any purposeful movement, that's a positive sign. From there, we develop a custom rehab plan. Early mobility exercises to prevent muscle atrophy, speech therapy for aphasia, and occupational therapy to coach her in daily activities. Should Amber awaken from her coma, the earliest therapies will focus on preventing further damage. This includes gentle passive range of motion exercises to maintain joint flexibility and reduce the risk of contractures. As soon as she is stable enough, physical therapy will guide her through sitting up, transferring to a chair, and eventually standing with support. Each milestone, lifting her right arm, pronouncing a simple word, taking a step, would be cause for celebration. But progress won't be linear. There will be setbacks, days when swelling worsens, days when fatigue wins. The Johnston family is bracing for an emotional roller coaster. They've set up a private support group for close friends and fans to share updates, honest, raw, unfiltered. Because in moments like these, community is the balm that soothes fear. No one knows what Amber's life will look like after this. Will she walk again unassisted? Will she speak without slurring? For a young woman who once danced through life's challenges with a radiant smile, the road ahead may seem daunting, a rocky, uphill climb. But if her track record tells us anything, it's that Amber Johnston does not back down from a challenge. Remember when she fractured her femur at age 5? The doctors told her parents she might never walk normally again. Yet Amber insisted on learning to dance at her cousin's wedding a year later. She's defied odds before. She's shattered stereotypes about disability. She's inspired a generation of fans to see life's possibilities instead of limitations. For the Johnstons, faith has always been the cornerstone of their lives. Their motto, "We all get the same 24 hours," reminds them daily of life's fleeting beauty. Now they hold on to that faith more tightly than ever. Trust in the Lord with all your heart, and do not lean on your own understanding. In all your ways acknowledge Him, and He will make your paths straight. Church members from Calhoun, Georgia, have brought casseroles to the hospital cafeteria, written prayers on sticky notes and placed them on Amber's four-pole, and organized weekly prayer vigils. Local businesses have printed Amber Strong t-shirts to sell, with proceeds donated to her care fund. Even small acts, a text message saying "We love you," a homemade card, help sustain the Johnston family's spirit. Tracy Johnston and her children remind us, we cannot control the outcome, but we can choose how we face it. We choose faith. We choose hope. We choose love. And that choice in itself becomes a source of healing. Amber Johnston's stroke is a stark reminder that life can pivot in an instant. One moment, she was laughing with her family. The next, she was fighting for her life. But in that darkness, a brilliant light has emerged. The unwavering love of her siblings, parents, fans, and even strangers moved by her story. Whether Amber ultimately walks out of that ICU bed under her own strength or not, her life has already made an indelible impact on countless hearts. More update. 7 Little Johnstons horrible Amber denies Trent. Fans want her gone. 7 Little Johnstons fans catch Bryce openly dissing Amber. And why fans call Amber and Liz Johnston liars? I will explain everything. 7 Little Johnstons horrible, Amber denies Trent. Fans want her gone, but why? After Amber Johnston's latest shenanigans in season 15 scenes, many Little Johnstons fans are appalled and want her off the program. Can you tell me what Amber did this time and how the audience feels about her? New reasons to hate Amber Johnston are revealed in every episode of 7 Little Johnstons. Many people would be happy to see her removed entirely, and the fact that most viewers despise her is obvious. On top of dealing with Amber and her shenanigans in 7 Little Johnston sequences, viewers get a double dosage of Amber and Liz, who many refer to as Amber 2.0, which makes things worse. Presently, Amber Johnston is unpopular among 7 Little Johnston's viewers, but by her reaction to Trent's grief at his father's death, she gave viewers even more cause to take offense to her. 7 Little Johnston's viewers recently witnessed Trent Johnston coping with the tragic death of his father, a situation that the TLC cameras were present to record. Despite Trent's desperate need for solace and reassurance, Amber acted as if she were in no hurry to be with him, even turning her back on his attempts to console him. In light of her previous actions, fans of 7 Little Johnstons have long accused Amber Johnston of being self-centered. After Amber Johnston's recent scenes with Trent Johnston, many fans feel that he deserves better, especially considering how hard he is struggling. Everybody has a problem with Trent, but everyone agrees that Amber is and always has been the bigger problem. An observer noted that Amber was avoiding Trent's hand as he spoke about his father. My goodness, that's incredible. A strangeness pervaded the body language. Trent, who was speaking about his dad's demise, appeared to be attempting to grasp her hand as he patted her arm. It appears that Amber no longer has any affection for Trent. She was so unable to even allow him to argue about coffee. Damn. He thought after his dad passed away, I love my coffee more than anything. That is, until it is Amber's suffering, it has no value, as another commenter put it. Nothing will happen until she is the focal point. She clearly lacks the emotional intelligence to console Trent. Well, that's it. She doesn't like anyone, lol, a third party noted. It will take some time before she betrays her grandchild. She despises her average size because she believes it would have been easy to take advantage of her when she was smaller. As far as intelligence goes, Amber is definitely one of those individuals. That kind of person eventually becomes socially inept and lacks wisdom. They start to hate those around them when they realize they aren't the brightest or most accomplished after all. 7 Little Johnstons fans catch Bryce openly dissing Amber, but how? Many of the 7 Little Johnstons admirers feel bad for Bryce Bolden and want him to get out of his jam with Liz Johnston. Fans have recently referred to a clip in which Bryce's anger toward Amber Johnston is plain to discern. Now the question is, what did the audience notice and how are they describing it? Most people feel awful for Bryce Bolden because of how things turned out last season and how they are appearing in season 15 scenes of the TLC show. Since the addition of baby Leighton, he has been subjected to an extra dosage of nagging from Amber and Liz Johnston. People who watch the show often express their wish that Bryce can get out of here and find a place where he is appreciated and respected. Most viewers don't give him a chance since he's stuck between Amber and Liz, and they're both trying to get under his skin. A small footage of Bryce's mannerisms while Amber Johnston was speaking was recently brought to the notice of 7 Little Johnstons fans. Many viewers have noticed that Bryce appears to be completely oblivious to Amber's words, just by observing his body language. Many things have been endured by Bryce. He has had to adapt to being a part of the overall dynamic of the 7 Little Johnstons family, with TLC cameras around, and to the addition of baby Leighton. The general public seems to think that Bryce Bolden is deserving of better. Just like this latest incident, Bryce has definitely had enough of hearing what Amber Johnston has to say. Viewers seem to be unanimous in their support of Bryce. In fact, several express concern that his situation would only worsen if he continues to remain. The number of eye rolls that Bryce isn't showing is something that one commenter recently pondered. "I can see right through him that he's unhappy," another commenter said. "Please, I want it to hit him sooner rather than later." Regarding the third party, they expressed their hope that he would discover his voice within the family, particularly with Liz and Amber. "Using your voice usually only makes things worse with people like Amber," someone else said as the conversation proceeded. "They aren't going to be tolerant. You're in a terrible position since you can't decide between doing it or not." Someone added, "That's right. Ambers are notoriously tough to deal with, because they refuse to budge. Withholding love, support, and affection is the punishment for refusing to comply, which no one does except Anna." Why? Because when you're around a controlling person like Amber, breaking rules will lead to consequences, and you'll always be seen as troublesome just for being yourself. 7 Little Johnstons. Why fans call Amber and Liz Johnston liars? Supporters of the 7 Little Johnstons aren't shy about ragging on Liz and Amber whenever they have the chance. That being said, there are a few good explanations for it. Their current accusation of lying by viewers was particularly stinging. What did the audience think then? The majority of fans would prefer not to see Amber Johnston and Liz Johnston in any scenes at all, even though they are integral to the 7 Little Johnstons plot. Season 15 has nicely illustrated why viewers hold this opinion. Everyone has used Bryce Bolden as a punching bag this entire season. In regards to caring for newborn Leighton, both Liz and Amber have on the offensive. That isn't the only thing though, for which fans have recently criticized the mother and daughter. Some may argue that the 7 Little Johnstons fanbase's dislike of Amber and Liz Johnston is unwarranted. Yet there's no denying that there are many valid grounds for the dislike. How much these two lie is one of the things that people often point out. Liz Johnston has made several false claims, one of which is that she is a nurse. Numerous viewers of 7 Little Johnstons have pointed out that Liz is not a registered nurse, despite her claims to the contrary. Some viewers find this irritating, among other things about Liz. The my way or the highway attitude of Amber Johnston has already made her unpopular with the audience. To Amber, it's always about her, and she loves to take charge of any circumstance she can get her hands on. Amber was criticized by another viewer for falsely stating Liz's profession on national television, adding fuel to the fire of Liz's nursing deception. Although several commentators who are actually ultrasound technicians deny that Liz Johnston is an ultrasound tech, she includes the occupation on her Instagram page nevertheless. Someone recently attacked her for this, and they weren't shy. Can we make a big point that Elizabeth is not a nurse, yet they act like she is? Said one commenter. It cracks me up. The question is, how can she simply go through life pretending to be a nurse? Another poster joined the conversation stating, I was binge watching episodes last weekend and Amber clearly said, Liz is a registered nurse. The answer is no. Telling a fib on national television is so ridiculous. Regarding the third-party statement, they compared it to referring to a drug dealer as a pharmacist, saying, medical assistant at best. As a senior cardiovascular sonography student, a fourth witness chimed in. Be assured that Liz is not trained as an ultrasound technician. If such was the case, you can find her record in the ARDMS registration database, American Registry of Diagnostic Medical Sonographers. She would also need to pass a physics board exam in order to practice sonography. Many people mistakenly believe it is easy. 7 little Johnstons. Amber Johnston accepted to prestigious school. But why? Amber Johnston recently made headlines when she announced the completion of her degree, but the star of 7 Little Johnstons will continue her schooling after that. Amber also announced her acceptance to a different institution on social media. Viewers have also been voicing their thoughts on the plot. The 7 Little Johnstons was where fans initially encountered Amber Johnston. The 7-member Johnston family, who all deal with dwarfism, is the focus of a TLC series. Amber recently updated her admirers on an educational milestone. Nevertheless, she promptly shared an additional update on social media shortly thereafter. Amber announced her official graduation from Louisiana State University on Instagram, so the Johnstons could celebrate yet another collegiate milestone this year. According to what the TLC actress wrote in the caption, she obtained a Master of Social Work (MSW). The above photo shows Amber and Trent, who are married, posing in front of LSU Tiger Stadium. Amber was spotted donning her graduation regalia, including a cap and gown. Having said that, Amber had not yet completed her degree requirements. Walden University is a Minneapolis-based private for-profit online school, and she later posted a photo of herself with a letter from them to her social media accounts. While Walden University was in the corner of the caption, Amber put, "My education journey continues." In the caption, upon closer inspection, the letter seemed to extend a warm welcome to Amber as she entered the school's doctoral program in social work. In response to Amber's recent degree, many of her admirers have taken to social media to speculate on her future career. Someone who follows her on Twitter speculated that she could want to work at the school someday. It is believed that she is aiming to enter the field of school administration, they wrote. If you want to earn money while working at a school, this is your only option. People from all walks of life, however, the vast majority pursue a master's degree in some field, social work, leadership, etc. Her lack of experience was also questioned by a few. It is not uncommon for people to pursue their PhD right after obtaining their master's degree, according to several commenters. Thus, employment experience isn't necessarily required to get into a PhD program. Getting a PhD does not necessitate work experience, one supporter remarked. After completing a master's degree, many students immediately enroll in a PhD program. Fans shared their thoughts on the tale in the comments. Some poked fun at the TLC singer, claiming it was all a substitute for working, while others spoke out in her defense, frequently drawing on personal experiences. Here are a few remarks. A well-educated individual. She will become a professor, in my opinion. Until that train runs out, she will be a professional student. When she is unable to do, she will teach. It's all right. To avoid working, Amber isn't going to work at all. She'll just keep collecting degrees. You can work as a clinical social worker with simply a master's degree and the LCSW credential. Amber is not yet qualified to take the LCSW exam, since she has only recently earned her MSW. This is my former mother-in-law. Very much so. Accredited professional learning community student. With only government assistance, loans, and Section 8 income, of course. Flounders around in a job. Continues to pursue more education. Getting a master's degree after a bachelor's is a treat. The finest choice I have made after finishing college was to get my master's degree online. All you have to worry about is covering the costs of books, tuition, and a laptop, if you don't already have one. But now that the TLC money appears to be flowing straight to Amber, she needs to step back and allow her own kids acquire degrees. Why fans think Amber Johnston's a sad, sick person? Leighton was well received by Amber Johnston, who provided more updates than the child's mother, Elizabeth, Liz Johnston. Several viewers of The Little Johnstons felt that Amber comes across as a tragically ill woman in their discussion of her granddaughter that took place this week. Trent Johnston was unconcerned with any additional updates from Liz after hearing about the scan. Rather, he was merely interested in learning whether Leighton would be small in stature. The typical size of the baby was a hot topic of discussion. Both Liz and her mother wished for a small human being. Amber and her desires for a child are currently trending among TLC viewers. Jonah and Liz Johnston were the only children born to Amber Johnston. Adopted were the remaining 3 children. Korea was Alex's homeland, China was Emma's, and Russia was Anna's. A lot of kids say their mom has preferences. Leighton appears to be her favorite so far. But she did not give birth to Leighton. Some viewers were anticipating tension between Liz Johnston and her mother regarding paternity at some point. But the matriarch seems to have always considered herself Leighton's mother. Someone on Reddit noticed that she acted as if she were the mother when discussing Liz Johnston's child from 7 Little Johnstons. The infant wasn't even born yet when that happened. According to the OP, who attacked Amber Johnston, "I've never had an average-sized baby." Observing a repeat. Amber elaborating on her support for a baby with LP genetics. "Listen up, Amber. This isn't your baby. That lady is ill." Several insightful comments were offered by TLC fans who swiftly established a thread in the conversation. Their remarks are presented here. "No joke. Her actions dishearten me. Think about it. You want your grandchild to be born with a disability that will last a lifetime. Yes, she is an awful human being. Her illness is severe. No one else gives a hoot about her LP distinction. She's the only one who has any reservations about it. That little one, though, will quickly learn the difference between a BCH and an overprotective mother. Due of Amber's determination, Liz will eventually take a back seat. Bryce ought to develop some backbone. It is my sincere wish that his parents will not give Amber the reins." No more today. What are you thinking about this gossip today? Let us know in the comments, and stay tuned by subscribing to our channel to get more updates like this. Thank you.